Hi, my name is Joe DeVivo, and I'm the Chief Executive Officer of Butterfly Network. I'm so excited that you can join us today. We're here in our New York offices where we battled a little bit of a snowstorm, but all of our employees came in to celebrate a really big event. And we launched our first version in 2018, the iQ Plus in 2020. And this is really a generational change for us with our iQ3. We're excited, and we're also excited to share with you some of the early feedback that we received and also give you a little bit of vision on what we think it means for Butterfly, but more important, what it means for our clinical partners and doctors around the world. So, John, you've been here since day one. You've been a great champion of the company, but more importantly, a great champion of point-of-care ultrasound. If you can help us put iQ3 in a clinical and an overall market context, could you do that for us?
Thanks, Joe. It's interesting in coming to this today and this monumental occasion for the company, you tend to pause for a moment and to look back and try to put things into perspective of what the journey has been like. And I look back to 2017 when I actually joined the company. And I had one question for Nevada Sanchez, one of our co-founders. And I asked Nevada the question, is there any limit to the potential of how good ultrasound on chip could be? Because I thought that was a really important perspective for me to make the decision that I wanted to make to join this company. And Nevada said no. And he said so in such a convincing way that I believed. I believed in that moment that there was no ceiling to what we could do. And I believed in my heart that if we could do the mission of this company and build something that was affordable, that was versatile, that could literally be put in the hands of every clinician, that we would change the world. And then we launched the probe in 2018. And I have to be honest with you, I didn't think there could be another moment in Butterfly history that would match the excitement that was. It was incredible. It was a realization of the vision that we could actually build something that did this, to do something no one else had ever done before. And then we began the journey with that, and we've learned so much over the course of those years. But we kept hearing same kind of nagging things of that's great and it's wonderful, but what about this and what about that? Doctors are infamous for that. And candidly, the biggest thing that kept coming back and nagging us all along was, well, can you make your image quality that much better? We suffered from, and it used to frustrate the heck out of me, we suffered from people would look at a high-end cart and say, I want that picture. And I said, I get it, but I would always come back with, do you need that picture to answer the question? And they would always say, no, but I still want that picture.
Right.
And so I believed in my heart that we could get there. And what makes today maybe even more exciting for me, and I think, and the team, because you could feel it with them, is that there's proof now that Nevada was right. And that with iQ3, we have built the most versatile, the most affordable, and the most remarkable handheld ultrasound device that now has an image quality that no one can come back to me and say, yeah, but I want that image.
Right.
And for me, then, I think it's a fulfillment of the dream that really started this entire company. And so I think that's what makes today special. And I think you and I would both agree that when we've seen the reaction of people that have had iQ3 in their hands, particularly those that have been with us from the beginning, there's a holy fill in the word that you want moment that all of them have, like, you've done it. You've actually done it.
Well, the four-letter word I use is gasp. I've seen and heard people when they see the image, especially legacy Butterfly users, to see the leap and the change in the quality and the fast nature and easy nature of the probe. It's been really rewarding.
I think it's kind of fun now when, you used to always kind of hunker down and you're waiting for the yes buts. And I talked a little bit to the team about that. Yes, but this. They can't say that anymore. And I think there's a whole lot of evolutions in this new probe. It's not just a better image quality.
Right.
There is so much more to this device than just that. And I think it's also, and maybe we weren't really planning on talking about this, but I think we should. I think there's a remarkable opportunity here to have what is now a high-end Butterfly probe. And then we have another probe. iQ Plus is a remarkable device in and of itself.
Yeah, I think That's one of the significant points of today is we are not now just a single product company from a hardware side. We have the best middleware in the market for hospitals to manage their image and proficiency management with our Compass software, and then we've had iQ+. But iQ+ is not being phased out. iQ+ will be in the market. It'll be in the market for $26.99 like it is on our website. And iQ3 will be on the market for $38.99. So it is a premium product, but we are also continuing to sell our existing product for those who are happy with the image quality and happy with all the features and also are happy with that price point.
Yeah, I think it's interesting and so timely today. I was sent a paper that compared iQ+ to a cart-based system.
Mhm.
And in that comparison, iQ+ actually fared just as well as that cart-based system in an emergency room with multiple clinical settings. And so I think now that we've got a high-end system in that one, it's going to be very interesting to see how the market responds. But I think, I would come back to you and say, okay, we had a great device.
Yep.
Why did we build iQ3? I know we're insatiated with the idea. I mean, I watched the Super Bowl on Sunday. And if I watched that on my old TV, I would still know the score. I would have seen Patrick Mahomes throw the winning touchdown, and I would know who won. But I love seeing the crisp images. I like to see the sweat on Usher as he's got halftime. I love those visuals. Yes. I couldn't see that on my old
So you should have
TV.
thrown him a towel.
Yes. So why iQ3? Why is it so important to define what Butterfly is really all about?
Well, I think, so I've been here 8 months. And what I have tried to do, I've had the blessing of being in the early phases of laparoscopy and working with US Surgical. I've had the blessing of being in very early surgical robotics with computer motion and then selling it to Intuitive. I've been able to see interventional oncology and orthopedics and vascular, and then telemedicine, which exploded through COVID. What I try to do when I'm looking at a new opportunity is to understand what's the essence of what we do. What makes us special? What differentiates us from the pack? And the more that I've studied Butterfly, the more I understand that our ultrasound on chip, our processing power, the know-how that has been created and developed to create that processing power allows us, just like you said in the opening, to have an unlimited pathway from technology and development. I've mentioned this to some investors in the past, but in a setting and hopefully talking to a lot of our customers, I haven't had the opportunity. But in 1995, the first digital camera was launched. It was launched by Kodak. It had very poor image quality, but it had all the benefits you want to have in digital. You don't have to develop photos that you didn't want. You can save them, you can forward them, you can move them without having to print them. And then Kodak jettisoned that program because they thought this would never, they thought it would never get anywhere. But Toshiba, Canon, and others identified that there were new processors coming out, and that processing power led them to be able to get better and better images. And the processing went from 1 megabyte file to a 3 megabyte file to a 5 megabyte file, a 7 megabyte file. And then 2003 was the first year that digital cameras outsold film cameras. And within that context, the moment digital equals analog equals digital lens, because there's so many benefits from digital, not just the core benefit of image quality, but then there's the benefit of cloud, the benefit of storage, forward, all the other things that you can do with imaging. And then, when we think about the future, well, the future is in miniaturization. And if we look at what camera we all use today, we're all using our iPhone or we're using a smartphone. Why? Because not only has the image quality gotten to a point of acceptance but now miniaturization takes over. And so when we think why now and what's so important about iQ3 is that we've hit that crescendo where our image quality, I mean, the imaging is beauty is in the eye of the beholder. And so we'll let you judge when you get it in your hands. We did do a survey, a blinded third-party survey of 475 doctors from 8 different specialties, asking them between iQ3 and GE's V-scan, which had the better image quality. And in a blinded environment, the majority of all of them picked iQ3, and it wasn't 51%. It was a much higher percentage. And so we knew prior to launching this product that we had something. But it's all about also, this is a journey. And we are already in generation, in our next generation chip, believe it or not. Here we're celebrating iQ3 today, but the next chip is already on the way. And iQ Plus had 4.8 gigahertz per second of processing power. iQ3 has 9.6 gigahertz per second processing power. And just imagine what we can do when we get to 18 gigahertz per second. The whole concept of point-of-care ultrasound, you look at what Apple is just doing now with their Vision Pro. You're empowering an individual to not be tied to a physical space, right? It creates this virtual environment where you can now pin all of your different things. And if you move around the room, you have your virtual screens pinned wherever you want them. And it's the same thing, we talked a little bit earlier about defibrillators.
Mm-hmm.
Who would have?
I love that example.
Well, so who would have thought that there'd be defibrillators all over the place? So maybe you can go into that first.
Yeah, I mean, unfortunately, I'm old enough to remember that the only defibrillators they had were inside the hospital. You actually had to be certified to use it. You had to be specifically trained. And so when there was a code, we would run into the room with a designated person to defibrillate somebody. And if you'd have said to all of us then that, oh, by the way, it's going to be hanging at the wall at the gym, and somebody who knows absolutely nothing about medicine at all is going to be able to take that thing off the wall and put it on someone and save a life, we would have said you're crazy.
Yeah.
And I don't see this as any different now in the world of ultrasound, because we've already started in Butterfly many studies that are moving toward the home with patients scanning themselves under an IRB research. And it's the reality.
Yeah.
And as you move toward that left of the care continuum, you save money, you improve efficiency. And at the end of the day, as a patient, and Lord knows I've been one, nobody wants to be in the emergency room and nobody wants to be in the hospital. And we can change that with Butterfly.
Yeah, and we don't have a desire to replace existing high-end workflows in facility. We have a desire to empower clinicians to immediately be able to make decisions, to get them to the right place, to help patients when time matters. And time matters financially inside a hospital. Of course, time matters to a patient when an important decision should be made. And when you think of Butterfly having an all-in probe, 20 presets, plus other different types of calculations and new tools that we're going to go through a little bit later, it's amazing that we can put so much power, so much capability into a small portable device. Butterfly has been depended upon all around the world. We are in 60 different countries. We have done a lot of work in third world. We have many partners in global health who are helping these communities or helping war-torn environments. We have over 1,000 probes in Ukraine.
Mm-hmm.
And I'm very proud of not being there to be able to help, because those medics that are out there not knowing what they're going to encounter, they can't pull out, well, I think I need this probe, or I think I need this probe. They immediately grab a Butterfly, they make a diagnosis, and they move for that soldier to save their limb or their life. And having it on their belt and having that immediacy is so important. And so the more power, the more capability we put into a single device, the more we can change the world, the more we can improve clinical care. And I think this is the moment where hospitals are going to start thinking more about a single platform versus a bunch of handhelds all over the place.
maybe this is a good moment to pause, and maybe we should show them what this looks like.
Goodness
Maybe
gracious.
we do that. Why don't we play the video and we'll introduce you to iQ3, and then we'll talk a little bit about how different it is and how iQ3 is the shape of point-of-care ultrasound to come.
You asked, we delivered. The new Butterfly iQ3. It's the answer in point-of-care ultrasound. With the sharpest image for easier, clear answers. Ready? At your fingertips. We've raised the bar by delivering best-in-class image quality with double the processing power and optimized clarity for definitive and rapid diagnosis. We advanced imaging capabilities beyond expectation and added new automated tools for you to get instant and consistent answers on the first visit. Because every second counts, we accelerated charging and extended scan times, so our device is ready when your patients need you most. With you in mind, we refined the ergonomics and designed a smaller, more functional shape, putting you in control of every exam where precision is key. To support the most challenging cases, we focused on swift image acquisition and brought you the world's first iQ Slice technology on handheld point-of-care ultrasound to capture multiple rapid views at the click of a button. You asked for better, faster, easier ultrasound. We answered with cutting-edge innovations to support you through every scan. Butterfly iQ3, the clear answer in point-of-care ultrasound.
Awesome.
It's like being proud of.
No, that was great.
It's a work of art that you're looking at going, yeah, we did that.
Yeah.
We actually built that.
You know, and as a leader of an organization, you know, to see, you know, just a shout out to all the butterflies out there. There's not an employee in this company who wasn't a part of moving this ball forward, a part of this innovation, whether it's our field and our clinical team with, you know, specifications and requirements and what's needed for the customers, to, of course, all the development teams, marketing teams. It's really awesome.
Well, I'm holding in my hands our Super Bowl trophy.
There you go.
And I can tell you, as cool as the Lombardi trophy is, this is cooler.
Good.
And so there's a lot of things that are very different about this. As you can see, it is a very different shape, a different size, a different head. You want to talk a little bit about some of the technical things that are different about this probe than iQ Plus?
Well, as you saw in that video, I feel like there are going to be three different eras for Butterfly. The first era passed, and that era was, can we do it? Can we use a chip to have an all-in-one device that would be able to provide point-of-care value to our customers? Not only have we done that, but more than we've sold more devices than any other company, possibly combined on a unit basis, where we've now sold well over 100,000 units of the first two generations. And so we've proven we can do it. iQ3 is the first step of the next era, which is not only we can do it and do it as well as our competitors, but we can now start doing things based upon our chip and our capabilities that they can't do. A piezo-based crystal, the handheld probes have crystals where there's a straight beam that comes out. I know there's higher end carts, $100,000 carts that actually move the crystal to auto fan it inside. But because we have a display, because we have our chip and the ability to control 9,000 pixels across that chip, we can direct the energy basically in any way that we want. And that's how we get the different arrays, because we program it for each of the presets. But one of the things that's so exciting about the future of ultrasound is AI and AI tools. And AI tools are designed to make it easier to capture an image, because we can't just rely on the 80,000 ultrasonographers. We want to empower physicians and nurses at that point of care. And ultrasound is the most difficult imaging modality of them all. For an MRI, you go into a room, you have a technician, he or she puts you on a table, they initiate a protocol, put you inside the machine, and then a very standard protocol algorithm is occurring, and they're taking a slice, taking an image over a 20-30 minute period. They now create this data set of slicing through your body, automated. Ultrasound, you have to be an artist. You have to know the anatomy, of course, and you have to understand the image and contorting the probe. And it's like, you know, a flashlight in the dark. You have to know exactly what you're looking for before you find it. But one of the features that we're starting to put in now is IQ Slice. And as you saw in that video, we can actually steer the beam. So for a novice user, you can place the probe in a single spot without moving it. When you initiate the protocol, it takes 46 different images. And then now you have the ability at the bottom of the screen to scroll and just choose which image you want. Very MRI or CT-esque, where the art of capturing the image is not as complex. You can have a less skilled person acquire the image by placing it generally over anatomy and then taking a series of photos. You don't have to make the patient uncomfortable, contort over a period of time, and then you're able to move forward. This is not something anyone else can do. And so this next era, we're going to continue to focus on tools and capabilities of our chip and our processing and our beam that no one else can do. And one of the things that's also really cool is we're going to be able to, even a little later, look around corners. We're going to be able to put a probe, and if you want to look around the rib, you can steer a beam by bending that beam to where you want it to go. So this next era is we're changing the game. And so if anyone is purchasing and getting onto the Butterfly platform, we have now opened our garden to third-party AI developers. So you're going to have more and more software come into an ecosystem that instead of you have to buy software with a probe and choose and constantly, you know, we've opened up our platform and we are working directly, and we'll have more announcements over the next month of more partners coming into our environment, because we believe that in order to democratize ultrasound, we have to be partners with all the AI companies. We'll never, as a company our size, organically develop all these solutions, and we're going to focus on delivering a platform that can live and continue to be productive over time.
You know, I'm asked often by clinicians that see this, what are the specs? You know, what's different about this probe? You know, I think right off the bat, you'll see it's a different shape. And this was a lot of work that went into building a probe that's ergonomically really comfortable in your hand. And everybody we put in the hand, okay, this feels right. And if you're scanning continuously for a long time during the day, that makes a difference. You're going to notice right away that the head itself is actually smaller. And that was really a response of how do we get in between the ribs, doing cardiac stuff.
17% smaller.
Yeah, and that 17% actually makes a difference. And when you see the real dramatic change in cardiac imaging, part of that is the change in the size of that. But it's also, we have a new lens. And the lens on this is now made of rubber, which has an enormous impact, 10 times the ability to actually sharpen the image as the acoustic waves move in and out of this probe. And so we've done one other thing that is incredibly important, that is we've expanded the range of the device. So it used to be 1 to 10 in iQ+, we're now 1 to 12 megahertz. So now you've got faster processing speed, a head that's more custom designed for ultrasound imaging and processing, a smaller head. And then there's some other cool things in that it takes less than half the time to charge this.
Mm-hmm.
So instead of going from 5 hours, it's now 2. So back up to speed very quickly. It scans longer. So we actually manage heat incredibly well. And I think one of the features, and what we may have some others talk about, the buttons have moved. So we say, why is that important? Because they're put in a more ergonomically placed position, feedback from our users, and they're now programmable. So as you scan and you get used to scanning, you often want to adjust the depth of the gain. And so we find ourselves reaching across the screen to do that. You don't have to do that anymore because you can program these buttons to adjust depth, gain, mode, and you can actually capture an image. And so there are a host of other features in here that are electronically that our team would talk about all day long that would confuse you and I. But at the end of the day, what comes out of this thing is remarkable accuracy, remarkable range, and an image quality that's candidly stunning in what we do.
And what's exciting is that if you're an existing iQ+ user, you have your existing user account, you have your scans, you just grab your iQ3 and plug it in and go. You know, it's just like your iPhone, when a new phone comes out, you don't have to establish all kinds of new. You're within the ecosystem, you're within the family, and you benefit that. And just very, very exciting. You know, we've always focused on how do we make this as easy as possible? Plug it in, go. How do you have all the presets at your fingertips? And then how do we make our software as intuitive as possible?
You know, I think about what we've learned over the years, and you think about what's the importance of image quality. And what I found is we have kind of a bell-shaped curve when it comes to image quality. When you're learning, great image quality really helps because you're getting used to, I want to know what it is I'm looking at. Something that we've actually done a nice job of with ScanLab that we can talk about. And then you get into this group where I'm very comfortable doing POCUS. It doesn't have to be a perfect picture to answer the question. And that's typically what we see with our experienced users. And then you get on the high end where I want to start answering some complex questions, looking at subtleties, for instance, in particular wall contractility or some nuances in lesions inside the liver. Then you really care about image quality again. And so I think people go through this journey. I really want it to be great. Don't really care if it's that great. Do I want it to be great again? And I think you're going to find with this device, you're going to be able to go on that journey and not be disappointed in any one of those places along the way.
And, you know, and on that note, you know, why don't we pull up the ScanLab image? You know, we launched this just about 2 or 3 weeks ago. And maybe, John, if you wouldn't mind, why don't you walk our viewers through how this works?
So this was really cool. You know, I get jazzed about this one because this one was a passion of our team to build out there. And what we wanted to do was we recognize what a tremendous obstacle learning is for people that aren't in the middle of training. If you're a practicing physician, as I was, and many of my colleagues are, when am I going to fit in learning how to do this into what I'm doing? And in medical schools, I don't have enough mentors. I don't have enough instructors. How can I learn this quickly? And we do a lot of learning on our own. And so you can't always have a professor or a mentor next to your hip. So to take that place, if you will, we put the tutor inside the device and built this education-only app called ScanLab. And what you'll see with ScanLab you'll see very good instructions and a video on how to position the probe in the right place to get the right image. Some technical tricks on how to do there. You'll tap the tab right next to it and it'll show you actually what you're supposed to be looking at. Then your eyes will move to the right and you'll see at the bottom a quality indicator. How good an image am I getting? And as you make those subtle adjustments with your probe, that indicator will go from red, not doing so good, to green. Oh, now I've got a good image. And when you get into that green, all of a sudden what's going to pop up on your screen is anatomic labeling of all the structures. Now, eventually you won't need that. You're going to recognize all of them. But if you're a learner, how cool is that? How quickly does that reinforce in your mind? I know exactly what I need to see. I know exactly what I'm looking at. And it takes you on that journey from novice to confident to an expert in a much quicker pace. And we have this now for lung, we have it for cardiac, and we have it for fast exam, and we're going to be rapidly evolving into adding these others. But I think ScanLab and the feedback has been phenomenal.
Yeah, it's been exciting.
In an education environment. And I think you're going to see us add more and more artificial intelligence tools in that education-only environment where we learn and learn on our own. And then we can actually take that once we get good at it into the clinical environment with the standard app that we have.
And I think that's what's key, because you had launched a while ago Butterfly Academy, which is our University of Phoenix. You know, here's our courses, videos, you can get your education, and then you can test yourself and evolve forward. We've recently launched Butterfly Certified, which is our live training courses. So if you literally want to be certified and have scan reviews and then be managed over a period of time, you have that. But boy, you know, other than those options, it's hard to practice. And having ScanLab allows you to practice, refine, and get immediate feedback using our AI tools.
Well, I think we've used up our time talking about a lot of things. I think we could go on all day long. As you can tell, we're pretty proud of our company, and we're pretty proud of the entire team and how they've built iQ3 and some of these features. Any closing comments? Because what I really want to do is we've had the luxury of bringing on 3 world-renowned clinicians who are experts in POCUS who are going to share their opinions. Listen, we'll confess to you up front, we're homers. We're proud of our product, and we have our opinions, and they're strong about them. But we're going to bring on some new folks here in a minute. But any closing comments you want to share?
No, actually, I want to.
You want to hear them?
I do.
Let's see if they agree with us. All right, so we've got 3 guests with us, and I would go on all day long to talk about their accolades and their accomplishments and their positions, but I think I'll give them the opportunity to introduce themselves. And maybe Dr. Ramos, we'll start with you, and then we'll go around the horn, and you guys can introduce yourselves and what brought you on this journey with us today.
Absolutely. Hello, everybody. Dr. Mena Ramos, family medicine physician by training and co-founder of Global Ultrasound Institute. I am just so thrilled to be on this panel, first and foremost, because POCUS has been the single most game-changing tool, technology, and approach that has allowed me to take better care of patients and to be able to share that with other clinicians around the world through education and implementation, really getting folks from point A to point B and using POCUS in clinical practice has just been very exciting. And in terms of this new tool, it's just, it's really incredible to see how it's going to really bridge this high tech, high touch environment that we now find ourselves in, bringing together the old style of medicine where we had so much more time at the bedside with patients and had that trusting relationship, that primordial patient-doctor relationship, patient-provider relationship, with this new world of high technology, answers, data, and being able to bring those two worlds together. And now with the iQ3, that I'm really excited to get into what specifically I'm really impressed by. Yeah, it's just change happens at the speed of trust, and having tools that allow us as clinicians to build that trust with patients with better technology is super exciting. So,
Dr. Druschel.
Yeah, hi everyone. I'm Dr. Mike Druschel. I'm a family physician in Flagstaff, Arizona, and I run a direct primary care practice and treat a lot of rural northern Arizona patients. I work with family medicine residents in this area, as well as medical students from AT Stills. And for me, I've been working with point of care ultrasound for a little over 10 years now, and it's been really exciting to see the evolution in point of care ultrasound from these niches in the world of medicine. And now, like Dr. Ramos is saying, it's
All right, I think we lost him for a moment. Until he comes back, Chris, do you want to jump in?
Yeah, sure. I'll go ahead and jump in. Chris Fox. I'm an emergency physician. I'm at UC Irvine. I've been there for over 20 years. I run an emergency ultrasound fellowship. Graduated 40 fellows from my fellowship, and I know they're watching because they're texting me right now. And
they're doing well now, Chris. Come on.
They're showing me some love. And then I also have an ultrasound and medical education curriculum for the School of Medicine. It's been in place for over a decade, but for about, I think, 4 years now, we've had medical students have their own ultrasound probe. And so that's been a really exciting process to watch the butterfly evolve from, before it was even a product. I got to go to the place there in Guilford and check it out in the lab and talk to some of the PhDs who are working on it, and then and just watch it iterate over the years. Has been a super cool part of my career to see that.
Well, I think our whole audience has listened to us rave about it, and I think they're all very anxious to know, come from your perspective, is Butterfly iQ3 really as good as we say it is? Maybe you could give us your unbiased perspective.
That's a really good question, and I was certainly I don't want to say okay. I was skeptical because when the iQ Plus came out,
we know you.
It's okay. So when the iQ Plus came out, I remember so you go from like the first version, the iQ, to the iQ Plus. It came to my house, and I was like unboxing it. My wife was videotaping me, and I was so excited, and it just kind of had it was definitely an incremental change between the iQ and the iQ Plus, for sure. Incremental change, and images got a little better and all that, but it didn't really, when I started putting it through its paces, it wasn't as much of an incremental change as I was hoping. And not to throw the iQ Plus under the bus here, but I can say that when I was scanning, I scanned for about 3 hours now with the iQ3, and I would say there's a gigantic jump here between iQ Plus and iQ3, significant, that I was pleasantly surprised of when I started to scan with it. And putting it through its paces. And in fact, the other day I had we were teaching an ultrasound course, so we had like other equipment there, and I had the iQ Plus, the iQ3, and I also had a like a brand new cart base that we were teaching the course on. And so I was doing all these comparisons on different standardized patients' windows all over the body, and I felt like sort of my take-home message was, boy, and I even kind of said it to myself, like, there's a way bigger difference between the iQ Plus and the iQ3 in terms of image quality than there is between the iQ3 and my cart. That's getting much more narrow than I'd ever imagined. So that I can definitely.
How much did you spend on that cart?
Well, I don't know. We get like a group discount. I don't know the exact number. It's probably around 70, 60, 70K. Yeah.
Wow. I wonder how many butterflies you could have gotten for that.
Quite a few. Yeah.
Quite a few. What do you think, Mina? What's your thoughts on iQ?
Yeah, I think the most dramatic difference I see is in the high frequency imaging, linear probe functionality for musculoskeletal imaging, for vascular imaging. I do lots of teaching with folks who practice in a primary care setting, and being able to differentiate between a full thickness rotator cuff tear versus a partial tear versus no tear can have tremendous clinical utility for that clinician and their patient, or being able to diagnose a carpal tunnel. And I think that was for me a limitation with the iQ Plus, was you were able to kind of see the structures, but it was difficult, particularly with partial tearing, because the structures are you just needed much better resolution. And that to me was really what stood out, was the iQ3. You had that resolution for those different layers and could start to differentiate those things. And for new learners, and you mentioned that arc of learning, where in the early stages, I find it nice to be able to teach with having a cart base because of that image quality, that now you have a handheld tool that you're not asking the learner who hasn't already had many years of experience and seen thousands and thousands of images to kind of just trust you that looks different from that. But it's much more obvious because the resolution is so much better. So kudos to the team and the iQ3 for linear, vascular, musculoskeletal, bread and butter primary care applications. It definitely allows you to answer those questions, which I thought was one of the limitations of the iQ Plus.
So I know we've sent out an APB to try to find Michael back again and solve that technical thing, because I think he brings a lot to the table as a practicing physician in a rural environment and teaching primary care docs. So hopefully we'll get him back shortly. You both are heavily involved in education, somewhat different levels typically. Can you tell us what you think the impact of iQ3 will have on the education programs? And maybe we'll start with you, Mina, and then to you, Chris, because now, Chris, I think you're graduating. You're now on your 5th class of every single medical student at your school having a probe and learning. So I'll be very interested to see your perspective on iQ3 and education. And then maybe, I think if you've had a chance to look at ScanLab, from your perspective, what does that do for your education environment?
Absolutely. I would say in 3 respective areas in terms of education. We typically train multidisciplinary teams. So folks who are inpatient, outpatient, in multiple different specialties, family medicine, internal medicine, pediatrics. So having something that has a lot of versatility is really, really important. And having various different functionalities, particularly with high frequency, which was a limitation, no longer a limitation. I think it just checks all the boxes for use in adult medicine, pediatrics, inpatient and outpatient, and skin, soft tissue, musculoskeletal. So that's number one, is versatility. Image quality we've mentioned, particularly for early learners, being able to build confidence is critical in that early stage of learning, because no one learns ultrasound in a single day. You can have a seed of an enthusiasm, passion, and a feeling that, yes, this is something, one, I should learn and that I can learn in that initial introduction. But really that learning happens through practice and through integrating that in a clinical setting and really seeing the utility of the tool in being able to make better medical decisions. And so better image quality from the beginning so that learners can really discern from one image, from one structure to another structure, and start to build that confidence that this is something that they can do on their own. And number three, reliability and connection, and being able to, when you're at the bedside, know immediately that when you plug in the probe, you got an image and you can immediately start scanning. You're teaching a group of learners. And seconds matter, especially in clinical environments, seconds matter. And so having that immediate connection probe into iPad or phone, whatever it is, and then you see an image right away, it's really, really important, because if you don't have a functioning probe, then you can't obviously do any scanning or teaching. So those three things, I'd say, the image quality, reliability, and versatility have, I think, will change the extension of POCUS with iQ3.
Your thoughts, Chris?
I agree with everything that Dr. Ramos just said. That was very eloquently put. You stole my thunder. No, I'm only kidding. I think that ultrasound is an art. It's hard to do. Every patient is different. And, you know, as sometimes being the expert in the room and 20 people are watching me do a trauma ultrasound, and I'm like, you know, nervous because everybody thinks I'm supposed to get the image like right away perfectly. You know, I know exactly what that feeling is like. Believe me, it's hard. I used to always say the novices should be the ones with the best equipment so that they can develop confidence, and only the true experts should be on the you know, the equipment that's got the lower quality, because they're the only ones that can make it sing. And it's the novices that should be started on the you know, on the big carts so that they get confidence and understand all the windows and feel confident. And so I could tell you that you know, the cardiac, the apical 4-chamber view, really hard to get consistently between patients. I always call it the worthy opponent that you need to you know, conquer, because there is so much important information that comes out of that apical 4-chamber view, of course. And that's the very first view that I did when I actually unboxed the iQ Plus, and then the other day when I was scanning with the iQ3. It's like, that to me is like the, you know, sort of the litmus test in, you know, in some ways. Other obviously there's lots of other uses that are important, but so I think for my students, getting back to that, I think that having more confidence and moving from patients with different, you know, body habitus, I think is going to be really important for them to gain confidence and want to continue to use it, because ultimately what I'm trying to instill in my students is a sense of curiosity about, you know, what can I see on this patient that could lower my threshold to pick up something that I wasn't considering, or to rule something out that I was worried about. And I think that it's that curiosity gets, you know, bashed out of you over the years of all of your training. But I also think that if you're going to struggle with the equipment, that curiosity is going to start to go away too. So that's why it's important.
Yeah, I think the early frustration of, you know, you hear other people say, oh, it's easy, pick it up and use it, and then you'd use it and you can't see anything. It's pretty frustrating, but I think with iQ3, people are going to have a much different experience. Well, welcome back, Michael. We're glad you've rejoined us. Maybe you could give us your perspective on what you think of iQ3. You've had a chance to see it. You've also been kind of an IQ person from the beginning, and you've seen the evolution. Maybe you share with us your views on what you think about iQ3, and maybe some discussion around some of the ergonomics and buttons and different things, and how you found whether or not they're useful and what impact they'll have on your scanning.
Yeah, absolutely. Yeah, thank you. Sorry, we lost internet to the whole building. Terrible timing. So the iQ3 for me has been it's been a big upgrade for me with especially diagnostic musculoskeletal imaging, which I do pretty in my practice. With that additional 2 megahertz, that's a 20% increase. And for me, I can see certain items such as a supraspinatus tear in the rotator cuff that I couldn't actually see with the iQ Plus, and I could do them back to back on the same person. So for me, when I had to give the iQ3 back for a little while, it kind of hurts a little bit, because you don't have that rich quality. You're like, oh, I miss it. And I know how much better it is, that clarity. And so I'm picking up diagnoses a lot easier than I used to. It saves my patients a lot of time and money. We don't use MRI as often here because I have that additional image clarity with the ultrasound. Other things I've noticed, the smaller footprint has made, plus the clarity has made echoes so much easier. Where before I would say I really struggled to get the quality images I needed with echoes. Now I am pushing myself to get better and better at it because I'm getting the quality images that I wasn't used to seeing in the past. And so for me, that's another huge gain with the iQ3. And so if you're doing echo, that's very, very big upgrade. I'd say the same is true on the lung side. I'm picking up pneumonia much easier because you can get through those rib spaces and see those B lines, not to mention some of the AI software around an auto B line counter. That's one of the cool new features with the iQ3 launch. And that's pretty validating, I think, for the novice learners. And you're like, oh, I think I see a beeline. But then when you have the AI software validate what you can see, just gives you that extra confidence. I know my colleagues here that I'm trying to bring along with me and train up in ultrasound. I really appreciate some of that extra confidence that you can get with some of the AI software tools. Same thing with the IQ slice technology. You can just kind of get that perfect view, just like you might with a bladder scanner, where you can start in the middle and then see all the way through that solid organ. I think other key points I've noticed, lymph node ultrasound is so much better. You get just so much more clarity in the lymph nodes, particularly in the cervical lymph nodes. I'd say the same thing's true with thyroid ultrasound. That additional resolution gives you a lot better clarity and gives me just that additional confidence that I can kind of go toe to toe with the same kind of ultrasound devices that my patients might get at the hospital, which is not always accessible, affordable, or timely. And to have that at the point of care makes a pretty big impact for us here at my clinic. So I do appreciate that. And I think the other big thing for me is the charging. It's like a mag lock. It right in, gives you that confidence that it's charging. And I really like that feature. It charges a lot faster, but it also, I know it's charging every single time. And you don't have to manipulate it in any strange way. It's just on or off. And that's really nice because I'm scanning a lot of time during my day here. And I can pretty much go all day long. But if you're going to do a lot of echoes or multiple scans back to back, just give it a quick boost and you're ready to go. And that's pretty great.
So suffice it to say, you've been happy with it.
Absolutely. Yeah.
Well, don't worry, we're going to get one back in your hands shortly, so you won't have to have gone without it too long. Well, I want to bring up a couple things that are controversial. You know, I want us to lean in a little bit, and I want to bring up maybe one of the most controversial things we talk a lot about, and the whole concept of wireless. Because iQ3 isn't wireless, and there's reasons for that, but I want to get your guys' perspective on wireless, because I would guess it may be the most common thing we hear, but why don't you have that yet? But I want your perspective of how important wireless is to you.
Yeah, I can
go ahead.
I did. I was demoing a wireless device about a year ago, and from a competitor company. And some of that lag that you get when you're doing your scanning can be very challenging to work with. And I know as you increase that resolution, you're just increasing that need for processing transmission power. And with the lighter form factor of the iQ3, I don't personally have any reservations at all about that wired connection because it feels just as lightweight as a regular probe would, even if you didn't have processing on the probe itself. And not have any lag is a must-have for me.
Chris?
Yeah, I mean, I guess it's probably where it's all going is to wireless eventually. But you know, it's like it's got to be like high reliability. It's got to work every time. And I feel like that's how we are in the hospital. That's why sometimes hospital technology lags a little bit behind like consumer grade technology because I got to make it like it's got to go every time. I don't want to be, you know, sitting there like futzing around like, okay, hold on, I'm gonna scan your belly, but hold on, I'm trying to find the Wi-Fi. Just what's this password? You know, or it's not connecting. I don't, you know, I don't know. I don't have the patience for that, frankly. That's my problem there. But so I love that it plugs in, it comes on immediately, and I start scanning. And that's for me. Someday they'll probably figure all the wireless stuff, and it's going to be awesome, and it'll be more reliable. But right now, I haven't had that experience like 100% of the time. It only takes 1% of the time for me to just lose faith in it for that moment, and I'm back to plugging stuff in. So.
Yeah, I think as you were describing that, there was going to be an expletive that slipped in there and you paused for a moment. Oh, that was very good. I appreciate it.
See how I did that?
Gina, how about you?
Very professional.
Yes.
I mean, I agree with both Chris and Mike. Reliability is key, and we train folks all around the world in lots of different settings, places that don't have any Wi-Fi. Sometimes at certain times of the day, and how many hospitals have you worked at where there's just certain zones of the hospital where Wi-Fi and signals are just wacky, which is why we still have, beepers in in a lot of places. So that connection and immediate connectivity, reliability right away is really critical in terms of the wire. And I haven't found that it gets in my way from any day-to-day scanning. If I had the capacity to have an immediate connection with zero lag and no wire and a screen somewhere that I could see very easily from any position around the bed examining a patient, that'd be fantastic. But for what we have right now, I think reliability and connection 100% of the time is top of the line.
Joe, what's our kind of company stance on this?
Well, I think, they've all answered the question, and they did it better than I could. And I think what Dr. Fox mentioned is exactly also the case. Of course, if you could, the way we thought about it is within this program, we went a far way where we thought we would have wireless in the program because we know that that's a desire. Butterfly customers are used to plug and scan. There's not and there wouldn't be a tolerance for turn on and then wait for all that variability. In my prior job, I was working with robots in the hospital riding the Wi-Fi network. And there had to be so much control and monitoring because you needed for stroke application for it to work every time. We got to the point where we felt, first of all, that the technology from a wireless standpoint wouldn't get us to that, turn on and scan. And there is a image degradation, there is a battery degradation when you're trying to push all that data wirelessly. You're subjected not only to different bandwidths with Bluetooth and Wi-Fi in the hospital. You have the IT department in the hospital constantly putting on different types of software to keep out in security software. And then you have to make sure that everything, doesn't get affected. So we've stayed on the path of making sure that when you plug it in, it works. And the moment we get our wireless, because we are working on that, but our standard is much higher than the current wireless products that are out there. And the moment we can go wireless and it works like that 100% of the time, then we'll have wireless. Until that time, we're going to keep, the quality, the battery life, and the ease of use for the customer's credit.
Yeah, and I can tell you that where the clinical team here is 100% behind that, because seconds do matter in a lot of different ways, and the confidence of being able to plug in Butterfly and use it are really important. Well, I think the other advance in iQ3 brings another great debate. We had Pepsi versus Coke. We had Apple versus Microsoft. Now we have handhelds versus carts. Maybe you guys could give your comment on the value of cart versus a handheld in the new world of iQ3.
When learners ask me, so, what device should I get? I usually respond with a question, and that's, well, what are you going to be using it for? What's your clinical practice? What's your clinical setting? And that usually that first branch point is cart-based versus handheld. And now that there is just much less of a gap in terms of image quality, as we were talking about the linear frequency, high frequency modalities, I can't imagine there would be a large group of clinicians doing POCUS where handheld, where an iQ3 couldn't answer those clinical questions at the bedside. Because that's what I mean, this is what we're talking about, right? We're talking about point of care ultrasound, making decisions at the bedside to take better care of people, answering yes or no questions, being able to make diagnoses, rule something in, rule something out, or at least have pretty good pre-test, post-test probability to make a better decision. That gap has significantly, if not completely closed. And yes, there may be some clinical situations where a handheld may not be able to answer that question, but I think for the general clinical community, starting to embrace and integrate point of care ultrasound, I can't think of too many examples where that would be the case. So I think it is absolutely game changing.
Michael, you dragging a cart around your office from room to room?
Definitely not. Yeah. It's been a while since I had a cart-based ultrasound in my clinic, and I'm so happy to leave it behind because when I have the ultrasound with me in the room, I'm going to use it. If I don't have to go down the hall to get the ultrasound, my chance of using has already dropped 50%. And so my med students actually like to poke fun that I can find a reason to ultrasound almost every patient I see because it's just right there. It's just like my stethoscope ready to go. And now, since I don't have to trade off that kind of high frequency near field resolution, there's no reason for me to have a cart. And so it's really nice to have it ready to go with my patient in the moment.
Chris, you have a very unique perspective on this because you've trained a lot of students now have had their own, and you certainly know, because we've talked about this, my bias, and that is, the first group of people that use POCUS think, okay, the point of POCUS is I don't have a tech do the study, I'm going to do it myself. But the further evolution of POCUS is I'm going to use this as part of the routine assessment of a patient for all kinds of things. And I don't believe you can actually get to that quickly unless you're scanning all the time. And to be scanning all the time, you have to have the device in your hand, in your pocket to do that. Tell us your experience with having students that are like that, what impact it has, and maybe the evolution now of everyone having one and not just the limited carts in the emergency room are going to make a difference in the care going forward.
Yeah, that's a good question. I think when it comes to learners getting, figuring out how to get the windows right and learning the art of sonography, certainly having access is a big issue. And so between shifts that they can practice whenever they need to, I think is really important to maintain those skills, doing those reps on it, especially when you're first learning. I think that's really important. And it's like as opposed to the stand when it's always in your hand, I think you're just always ready to do it in any clinical situation that you're called to. And I can tell you that in my specialty, emergency medicine, you've probably seen it on the news now. We're just experiencing crazy overcrowding and boarding, and patients aren't getting upstairs to admitted beds. They're staying down in the EDs. And, what that's causing to the field of emergency medicine is a whole new type of practice called waiting room medicine, which, we've practiced in the past from time to time during periods of surge, but now it's just like our everyday. And so we are finding every tiny little nook and cranny to see a patient in. And I can tell you out in my own triage area where we just redesigned it again for like the 100th time. And, there's just not a lot of room to move a cart between those rooms out in triage, where I do a lot of ultrasound now. Probably the majority of my scans are done in triage. And so having it, on my person, I think definitely lowers the threshold to do it. So yeah, but I was just sort of waiting for the image quality to catch up. I think that's been, I think everybody's been waiting for that, frankly.
Absolutely. And just piggybacking the continuum of care, John, you mentioned this earlier, being able to reach patients even before they end up in a waiting room or in a primary care visit or even in a home visit, and for just the extension of care into the community, meeting patients where they are, having something that's truly portable to be able to do palliative care, to be able to do procedures in the home, I think it just, having cart-based devices for those types of clinical settings would just be very, very much more limiting, I think.
Well, we're getting toward the end of the hour. I want to give you guys an opportunity to take a moment and say, put this in perspective. What is the emergence of iQ3, its image quality and features, the features like iQ Slice and Fan that you've seen that are revolutionary on a handheld device. Put that into the perspective of the evolution of POCUS throughout your career and maybe where you see the future going from here. Michael, you want to start?
Yeah, sure. Yeah, I see this as a big moment where image quality has really caught up with the iQ3 with the same kind of image quality I'd expect from other devices. And now we have additional AI-based tools that is going to make this even easier for the learner or the novice or the tech to come in and figure out how to use it. For me, having one device to do everything I need to do on a patient, whether it's a home visit, hours away from the hospital, doing procedures, or whether it's in my office, to make that rapid diagnosis and have the confidence behind it. It's a pretty big moment. And for someone who focuses on musculoskeletal, who does a lot of the heart and lung ultrasound as well, that gain in resolution was critical for me. And I think that's what's going to make everyone kind of come along and agree that point of care ultrasound is game changing. And I think as we get more of those stories out there of how we can make these rapid diagnoses, show to our patient exactly what's going on, and get them the immediate point of care treatment that they need because of this information, it's going to change lives. I mean, it already has for my patients, and it's much more accessible. And I think because Butterfly has taken this whole package and put it into this device that you can take with you anywhere, that's reliable with you 100% of the time, and is affordable enough that we can get it in the hands of the med students and the residents. It's just like your stethoscope. It's just another part of your toolbox. But it's taking that to the next level that I think can rapidly change patient care, improve outcomes, and make ultrasound accessible for almost all physicians if they're just willing to try it.
Chris, you know the history well, and you like to talk about the history of POCUS. Can you put this into perspective?
Yeah, thinking back, I was just doing that in my head, just thinking back about where I started with POCUS in 2000 and kind of where it is now. Back then it was all about the cost and the politics and issues like that. And it was not very democratized, I would say. And now we're seeing, never in my wildest dreams would I have ever thought there would be a single transducer that can do what this does for the cost of this, that it was going to be present in the hand of every single one of my medical students, and regardless of what specialty they go into, and put imaging on the the mind of every single medical student, to me is absolutely a dream that I could never have imagined back when I got started. And I got started late compared to a lot of the early pioneers, as you saw from my the talk that I gave about the history of POCUS. So no, it's been great to kind of watch this whole thing unravel and to see where it is now. It's pretty exciting, especially with, I was going to say one more thing just about that scan lab and being able to see all the labels pop up. I think it's important. I know you showed that in the beginning here, and when I first saw it, I thought it was like, oh, you're like moving the probe around and it's like on a mannequin, or no, that's actually on a real human being, any human being, and the labels actually pop up, allowing students to scan themselves and do those reps between the next class when they come ready to scan again. So I think that's a whole nother thing that's happening with AI and labeling, and that eventually this whole thing, I mean, I ruled out a DVT last night, one of my patients around 10 p.m. and I didn't have any students or residents with me. I was by myself, and I just started teaching the guy how to rule out a DVT on himself. I don't know why. I was just showing him like how easy this is, and he was like, "Oh yeah, I totally see it compressing." And so I think that's where this is going. It's going consumer grade, with AI. I think that's the next step of POCUS. It's just gonna evolve itself into everybody's homes. Think about the point of care lab testing that occurred during the pandemic that suddenly found its way into all of our homes. Maybe not the best example, but I just think the trajectory that this thing is on right now, it only makes sense to me it's going to end up as a consumer grade device.
Amina, you do teaching all over the world. You've done amazing things with Butterfly in the developing world, and yourself with Gussie. Where do you see this and how it's impacting the global health environment?
Absolutely. I mean, if you take a step back, big picture, still about half of the world doesn't have access to basic diagnostic imaging. I think we sometimes forget that this is the landscape that we live in. And so having a tool that is much more accessible, that is it's not the price of a car, but a nice laptop, that it's something that clinicians all around the world, it just lowers the barrier to access and ultimately adoption. I think having learning tools that can add a little bit of extra boost for learners to start to build that confidence also will just impact the scalability of adopting POCUS all around the world. And when I think about the critical problems in medicine, access is one, and trust is another big one. There's so much technology that while it gives us so much data, sometimes that technology can breach that connection between the patient and their healthcare provider. And if there isn't that trust, then all the answers may not matter. It may not lead to actually better outcomes and a patient walking away feeling like they got good care. And so I taught a new learner who was really hesitant to start adopting POCUS, but it recently became a requirement in family medicine training and was kind of the last holdout in the residency to start learning POCUS. And she walked away from the course really bought in. Why? Because she saw that in clinical practice, having patients who trust her, who even if she says go to the hospital, go to the ER, they may not go. In fact, they may just say, I'm not going to go. You've been my doctor for 25 years. I don't want to go to the ER necessarily. I don't want to go here or there or wait. And so having the capacity to get answers right at the bedside for potentially half the world that doesn't have basic access to diagnostic imaging, and fostering that trusting relationship that is just so fundamental, critical, primordial in medicine. It's why this is an art and this is a practice. It brings the humanity back to medical care, is the reason why I'm here and why I'm so passionate about not just this technology, but an approach to being able to care for people. And so I'm just, thank you so much for hosting this webinar and for putting out into the world tools that can really make a difference in people's lives.
Well, thank you all very much. Your contributions to point of care ultrasound and education are legendary, and you've left offspring of people that are changing the world. So we thank you for contributing today and the contributions you make going forward. And we look forward to more insights that come from you. Joe, can you give us just a few closing comments as we close this out?
Well, first of all, I have to repeat, Mina, Chris, Mike, thank you so much for coming on today. I know that the people who are on learned a lot, and not just about the product, but the importance of point of care. We're very committed to realizing that vision that you guys have. And we think that not only are we able to get very close now, there's an awesome roadmap into the home, everything from wearables, patients being able to do things on their own. And the future of healthcare is about managing in those rural and those remote environments, or managing higher cost or complex patients in the home, as well as empowering every doctor to have their imaging. So we're just so happy you're on this journey with us, and just want to thank you very much for joining us today.
Well, thank you all very much. It's been a great experience with all of you, and I'll leave you with two comments. Number one, if you're ready to go get an ultrasound device, go onto the website and buy one. And if you're one of those people sitting on the sidelines waiting, all I can say to you now is it's time. Get in the game. Good night, everyone, and thank you very much.
Thanks, everybody.